BV versus thrush. So I hope you can hear me okay today. We'll be talking about BV or bacterial vaginosis versus thrush. So basically we'll be discussing the similarities and the differences because you can get confused between the two. As you'll see through the presentation today, there's quite a lot of similarities actually. So perhaps you've experienced a vaginal infection. It can be so confusing to know exactly what is going on downstairs, and it can be quite frustrating as well. There's a lot of misdiagnosis that can happen through going to see your doctor as well. There can often be an overlap in symptoms, as I've discussed, when it comes to infections in the vagina. So it can be difficult to distinguish exactly what infection you have there. And if misdiagnosed, you can experience a lot of discomfort and you can be at the end of your tether with it really when you've been treated with the wrong thing for the wrong vaginal infection. And two of the most common vaginal infections that we'll be discussing today are bacterial vaginosis and thrush or vaginal thrush, okay? So hello, I am so thrilled to be here. For those of you that don't know me, my name is Michelle Cooke. I am a period and hormone naturopath, a natural fertility educator, and a practitioner, so a naturopathic emotional release practitioner. And I see women struggling with their menstrual cycles, have easy periods. I help them have easy, pain-free periods, emotional well-being and balanced hormones. And I practice in Melbourne and I see patients both online and face-to-face. I am the founder and director of Reproductive Wellness, which is a clinic located in Melbourne. Okay, so if you have any questions as we're going through the live, as per usual, you can pop them in the comments down below. If you're a bit shy, you can send me a PM or DM and I'm more than happy to answer that for you. If you're enjoying the content as well, just make sure that you hit the love hearts and the likes, just so that I know that I'm not just speaking to a screen and that you're enjoying what we're talking about today. So let's get started. So what is BV or bacterial vaginosis? So otherwise known as BV, it is a condition where you have vaginal dysbiosis. So basically it's an imbalance of bacteria that are found in your vagina. So there's an overgrowth of anaerobic bacteria, including Gardnerella vaginalis, the Prevotella species, you'll probably have a laugh at my pronunciation, but the Mobilinicus species, I'm not very good at pronouncing these, sorry. A vaginae is another one, and other types of bacteria associated with BV as well. So normally in a healthy vagina, you'll have abundant levels of lactobacilli. That's normally what's found there in a healthy, normal microbiome of the vagina. So the symptoms of BV. So you may have some of these or all of these, or you might even have none. There are some women that are asymptomatic, which means that they actually don't have any symptoms. So these are some of them. So painful burning or stinging when you do a wee, itchy vagina and vulva. So the vulva is basically the external genitalia, so the female genitalia. Sore vagina and vulva. A foul smelling vaginal odor. So it can be fishy or just unpleasant. There can be an abnormal vaginal discharge, which may be sort of thin discharge. It may be coloured white, grey or green. And there can be pain or discomfort either during sex or after sex. And symptoms do seem to be worse after sex as well, so keep that in mind. So what contributes or causes BVs? So there are quite a number of things. So eating too much sugar or sugary foods. So that leads to consistently high blood sugar levels, which leads to a rise in insulin. This will lead to the production of less glycogen, which leads to fewer lactobacilli, or that special sort of good bacteria that's found in a healthy vagina. There'll be less of those lactobacilli bacteria. And they're really, really important to maintain vaginal pH. And it would normally keep the bad bacteria at bay as well when the pH is under control. The vaginal environment is normally acidic, so it's normally a pH of under 4.5. That's normal for the vagina. But if the pH actually goes above 4.5 and becomes more alkaline, it's more prone to infections in that state. Also, if you're consuming too much sugar and sugary foods, it does dampen the immune system as well, making you more vulnerable to these vaginal infections. Low estrogen is another contributor to BV. So when you have low estrogen, basically there will be fewer bacteria, lactobacillus bacteria, that will maintain the pH, okay? So normally, sorry, just a moment. I've been having a few technical problems this evening, so I'm really glad I could actually come on, actually. Okay, where were we? Okay, so we talked about the pH having to be under 4.5 to maintain that healthy vagina. So if there's a low estrogen, this will affect the pH as well. And the lactobacilli species are responsible for producing lactic acid and hydrogen peroxide, which maintain that pH. But with low estrogen, there's low levels of that lactobacilli, which is that good type of bacteria found there. So that's an issue that will predispose you to BV. So times when estrogen may be low, so that can be hormonal fluctuations through your menstrual cycle. It could be perimenopause, which is the journey towards menopause. It can be from oral contraceptives that can disrupt the normal healthy microbiome in the vagina. During pregnancy, postpartum as well. Now, another issue or a contributor could be poor gut health and gut health dysbiosis, or gut bacteria dysbiosis. So there's an imbalance of gut bacteria there. And poor gut health and gut dysbiosis, or an imbalance of the bacteria, as I mentioned, does actually contribute to the status of the vaginal microbiome as well, or the balance of the bacteria and the microorganisms that live in the vagina. So we normally have things like bacteria, fungi, and viruses normally living there, so it disrupts that normal little family that you have there. And there's a specific family of sort of gut bacteria called the estrobolome. So they're actually specific for maintaining healthy levels of estrogen in the body. So if you've got an imbalance of gut bacteria, that will cause an imbalance to the estrobolome, which will mean that there's nothing managing estrogen levels. And remember, when your estrogen levels are affected, this can increase the risk of having BV, particularly when it's low, okay? Other causes or contributing factors can be antibiotic use, cigarette smoking, vaginal douching, multiple sex partners, new sex partners, because there's different microbiomes there at play, unprotected oral, vaginal or anal sex, also intrauterine device usage, vaginal products such as deodorants and washes, and oral contraceptives as well. I think I might have mentioned that earlier. So let's talk about what is vaginal thrush. So otherwise known as Candida vaginitis, or CV, or vulvovaginal candidiasis. And it's a type of yeast infection. So As I mentioned, we normally have candida in a normal, healthy vaginal environment. It's normal to have it there, but it's not normal when it overgrows. That's when it becomes an issue. So it's an overgrowth of the fungi known as Candida albicans. Okay, so as I mentioned, it's an issue when it actually decides to dominate and overtake the real estate in the vagina, because it's all about real estate there. So if that overgrows, it puts other things out of balance as well, if that makes sense. And it leads to issues downstairs, so i.e. in your vagina. So what are the symptoms of vaginal thrush? So you may have some or all of these. So there's a yeasty smell downstairs or at the vulva. There can be a scaliness or a red sort of itchy rash there. There can be painful burning or stinging when you do a wee. There can be pain during sex. There can be vaginal discharge that is white and clumpy, so it often resembles sort of cottage cheese-like consistency. There can be a soreness and redness at the vulva, and there can be an itchy vulva and vagina, okay? So what contributes or causes vaginal thrush? So similar actually to bacterial vaginosis, so eating too much sugar or sugary foods, diabetes, low estrogen states, as I mentioned earlier, poor gut health and gut bacterial overgrowth. Antibiotic use is another one. Vaginal products, so the use of deodorants and washes, that changes the pH of the vagina. Oral contraceptives is another one, and vaginal douching as well. I don't recommend doing that either, because that will also disrupt the normal healthy pH of the vagina. It's self-cleansing, so you don't actually need to use anything there to clean it. If there is a smell there, it usually indicates there's some sort of infection going on. So let's talk about it. We've probably already established there are some similarities there, aren't they? So let's point them out. So the similarities between BV and thrush are pain or stinging when you do a wee, an itchy vagina or vulva, a sore red vagina or vulva, and pain or discomfort during sex. So you can see they are quite close there, aren't they? So let's talk about the differences then. So the differences are the smell. So with thrush, it's more of a yeasty kind of smell, okay? With BV, it's more like a fishy or kind of unpleasant odor. You can actually smell yourself, you know, there's an odor there. Now the discharge is different between them. So with thrush, it's more thick, white, and cottage cheese-like. With BV, it's more of a thin discharge. It can be white, green, or grey in colour, okay? So what should you do then if you're experiencing discomfort or irritation at the vulva and the vagina? It can be so uncomfortable and just, yeah, it can really affect, you know, your day-to-day you know, what you're doing throughout the day as well. So it's important to actually get diagnosed by a doctor. And another option actually is to head to a sexual health clinic. They do a lot of testing there as well for you. And basically they will do a vaginal swab to determine whether it's actually thrush or BV. Unfortunately though, I hear of so many women that go to the doctor and they're actually misdiagnosed. That's happened to me for sure in the past when I've gone to get a diagnosis and I've been diagnosed with the wrong one. And you know, the symptoms are quite similar, and it's because some doctors actually don't do testing to actually rule out, is it BV or is it thrush? They might do an STI test or an STD test, but they don't actually establish whether it's BV or thrush. And there is a big difference there, as you can see. And it can be misdiagnosed based on the symptoms because there's a lot of similarities there, isn't there? And the medical treatment of that is very different. And same with the natural treatment too. The treatment is different also with the different herbs that you might use. You know, you might use antifungals more with thrush, whereas BV, you're using more antibacterial, antimicrobial herbs. So very different approach. With the medical treatment, they're using pharmaceutical antifungals for thrush, whereas for BV, it's often antibiotics. So totally different. So make sure you do that. Either see a doctor or go to a sexual health clinic and just make sure that you get a vaginal swab to actually determine which one you have. Don't accept being diagnosed just upon symptoms alone. It's usually not enough. My other suggestion is to see a naturopath. So a naturopath that specializes in periods and hormones, like myself. So have a naturopath as part of your healthcare team. It's so very important to provide a more holistic treatment of BV or thrush, to look at, you know, preventative measures as well as symptomatic relief. You need more than just symptomatic relief because you don't want it to actually reoccur again. And I see a lot of women that have, you know, reoccurring thrush, reoccurring BV and that kind of thing because preventative measures weren't put into place. It was just simply the symptoms that were addressed and eradicating that, you know, overgrowth of thrush or bacteria, but that's not actually going to get to the root cause of the problem. So if you see a naturopath like myself, we'll be assessing for hormone balance. So through pathology testing, remembering that if your estrogen is low, that's going to affect the pH of the vagina. So that will actually increase your risk of vaginal infections. Okay. So very important to assess that and use herbs to actually help and support your estrogen levels. The other thing is assessing gut health. So that's through microbiome testing. So that's looking at good and bad bacteria in your digestive tract, you know, making sure that you've got enough good bacteria to see if it's low or high, to see if there's bad bacteria there and what levels it is, and lots of other different parameters as well. It's a very comprehensive test looking at your digestive health, remembering that the estrobolome is in your gut, so that's very important at managing estrogen levels. So we need to make sure that your gut is working optimally as well in terms of those vaginal infections. It's all interrelated. Assessing the vaginal microbiome. So this is looking at the microorganisms that live in your vagina. So basically, as we discussed, it's looking at bacteria, fungi, and viruses that normally live there. It's very thorough, that test that I normally do to look at the vaginal microbiome. So it looks at different species of good bacteria, bad bacteria. It looks at STDs as well. It looks at fungi that are there. And it's looking to see if there's BV there as well. So that's a vaginal swab as well. So a nice and easy test. And also I recommend seeing a naturopath because the best way moving forward just isn't simply to treat those symptoms. Remember, it can reoccur again, and there's different things that are making it actually be there in the first place. So that's why I would recommend it as well. Now, so usually in my clinic, I'm using a combination of herbal medicine, nutritional medicine, diet and lifestyle measures based on the pathology testing that we get done to help, you know, prevent it coming back for you and to treat the symptoms, provide relief, etc. So if you're experiencing bacterial vaginosis or thrush, I would absolutely love to help you, and I invite you to book a free discovery call. So it's 15 minutes together where you can determine whether we're a good fit, what the treatment would involve, and ask any questions that you may have. So the link is in my bio if you're watching on Instagram. If you're watching on Facebook or YouTube, I will pop the link down below for you. And remember also in terms of all my Instagram and Facebook lives, they're actually all on my website. So if you've missed any previous ones, they're actually on my blog. So if you go to reproductivewellness.com.au/blog, they're all there with the video and the written description underneath. Okay. So is there any questions before I disappear this evening? Not so far? Great. If you think of any, just pop them in the box down below. But I would like to thank you so much for watching this evening. I really do appreciate it. And just an FYI, I'm here every Wednesday, 6:30 p.m. Australian Eastern Standard Time, talking about something related to women's health, periods, hormones, and menstrual cycles. So I very much look forward to seeing you on Wednesday. Just be sure that if you're watching on YouTube that you subscribe and like my video as well, just so that you don't miss any future videos that are coming out in the next coming weeks. But I look forward to seeing you next week, and I hope you enjoy the rest of your week. Thank you so much. Bye.